It's that time of year again. It's back to school time, and as your child or children get ready to hit the books, it's the perfect time to schedule their dental appointment. We're joined by Dr. Tanya Perry to tell us why these visits are important.
A dental checkup at the end of summer or during the summer holiday is very important. So one of the things that happens when we have holidays is that our routine tends to change. Now, summer holiday is the longest holiday, and a lot happen. Sometimes the kids get sent overseas, sometimes they get sent to the country, and those who are at home are sometimes with older siblings or, a younger relative, so to speak. So certain things change, habits change. They're waking up late, they're going to bed late, so they are not brushing properly. They are not flossing. Some kids literally throw away the toothbrush for the holidays because most time mommy and daddy aren't there to supervise them, and their older sibling may be doing what they're doing. So the oral hygiene breaks down. Also, summer is hot. They tend to drink a lot of juices, putting them at risk for cavities. They're also snacking a lot. You know how children are. You leave them alone in the summer, they'll eat down the house. They are snacking a lot. So that will put them at risk for cavities and gum disease. Studies have shown that many missed days at school are due to a toothache. So you want to ensure that your children are getting checked to ensure that they're starting off the school year right, not just with clean teeth, but also that any cavities are filled, especially if they're doing big exams like PEP, CSEC, and CAPE. You don't want them to be missing days. It's very important that they're in school and the focus is on the learning and they're not missing their learning progress. Also, summer is one of the easiest time to schedule their appointment because they're at home, they don't tend to have all these activities, they don't have the conflict with school hours and extra lesson. So it's an easy time to get all the kids together. Cavities is definitely at the top of the list because children do snack a lot. And you will tell them don't eat the sweets. They'll eat it anyway. Children are very creative. A lot of parents would come in and say that they find the sweetie paper in the bed. They'll be drinking a lot of stuff that they're not supposed to be drinking and in amounts that they're not supposed to be drinking. So cavities is at the top of the list. There's also gum disease because they're not brushing properly and the plaque is on the teeth. So you might find that they might have the bleeding of the gums. A lot of times, especially in teenagers, we tend to see that. Dental trauma is also something that we'll commonly see in kids. You can have broken teeth. You can have, unfortunately, knocked out teeth. So trauma is also a big one. Problems with growth and development of the teeth and the jaw, probably not as common, but we do need to check for that because sometimes the teeth don't come in, sometimes they don't come in the right place. Sometimes there might be problems with the growing of either the top jaw or the bottom jaw. Flossing is very important. If you're not getting your teeth flossed, you are missing about 35% of your teeth. So imagine you're cleaning your house and you're leaving that little area with stuff there. It's gonna start to smell and cause problems. So flossing is very important. We start getting the kids' teeth flossed from the teeth start touching. So normally those back molars will come in anywhere between 18 months to 2.5, the last two back ones. So from the teeth start touching, you start flossing. So you're looking at about age 2. And you continue right up after that into adulthood. It's supposed to be 1 time a day, which is not very difficult, but a lot of people do find flossing very tedious. The simple one with the finger, around the finger, works fine. But sometimes to encourage the kids, especially when you want them to start flossing, you may want to get into the character ones. So the ones with the handles sometimes come with the characters. And anything with characters or flavors will encourage kids to want to try it. They'll get excited about it. So you can make the moment exciting. You make the moment exciting, you'll develop a habit, and it's something that they'll want to do and they will do. You don't want to be giving mouthwash to children under age 6. The American Dental Association does not recommend that they get it under age 6. Remember, under age 6, they might end up trying to drink it, they might end up using too much. So it could possibly be harmful for them under age 6. Mouthwash is not necessary for all children, but it can be beneficial for some, especially children who have high risk for cavities. A fluoride mouthwash can be very helpful. I would still recommend that even up to age 12, so between 6 and 12, if you're using a fluoride mouthwash for kids, and I'd recommend that you use one that's specific for kids. So it would be more kid-friendly in terms of the flavor and the colors, that you still supervise them. So don't just leave it and let them, be rinsing them out, because even an 8-year-old might sit down there and rinse out them out the whole time. So you still have to kind of supervise it and let them know we only use this. You cover the bottle, you put it away, we only use it in the morning or in the evening, whatever the recommended timing is for it, it would be on the bottle. So it can be beneficial. Again, in teenagers as well, fluoride mouthwash can be beneficial. Speak with your dentist first to assess the risk for the child and get recommendations. But remember, no mouthwash before age 6. You're gonna be brushing the outside of the teeth, you're gonna be brushing the side that you bite on, and you're gonna be brushing the side on the inside. A lot of people miss that side by the tongue. So you're gonna be putting a bit of the toothbrush on the gum and on the tooth, and you're gonna be making movements forward and backward, and you're gonna go right around. And then when you're finished, you're gonna make some nice big circles, and don't forget to clean your tongue. Take the kids out, get them checked, let them start off the new school year on the right foot. Just like how the school book, the school bag, and the books and all is important, starting out with a proper dental health is important.
Cheers to a productive school year with healthy, happy smiles.